Between 1946 and 1948, more than 1,500 people in Guatemala were part of an experiment by American doctors infected with syphilis. An investigation by the government of Guatemala says this was done to test the effectiveness of penicillin. Rafael Espada is the country's vice president. He says the experiment was carried out by 10 doctors from the U.S. and 12 from Guatemala. A group of prostitutes was used by the doctors to infect prisoners and then the soldiers. More experiments were done with mentally ill patients and orphans. A Wellesley College professor made the find, uncovering medical records while looking for more information on the Tuskegee syphilis study in Alabama. In Tuskegee, already infected patients were not treated. They were all African Americans, the study done to chart the evolution of the disease.
There were questions. They knew it was on the ethical edge.
In Guatemala, victims are suing the U.S. government and the Pan American Health Organization. From President Barack Obama, an apology. But attorneys believe the victims deserve more than this.
We took people who were healthy and intentionally gave them this disease without them ever knowing what was being done to them.
The case has caused an uproar in Guatemala, where victims and witnesses say the experiments continued after 1948. And since the records went public, new victims have come forward. Carlos Telon suspects his brother, Victor Manuel, was infected in the psychiatric hospital. The doctor that treated him for years was one of those mentioned in the syphilis study, he says. Victor Manuel is now paralyzed, with numerous scars on the base of his spine and on his genitals. Now his brother hopes the lawsuit will bring better treatment and a decent bed. Lee Powell, The Associated Press.